Heart disease is the leading cause of death for women, but it's often thought of as being just a man's disease. My colleague Dr. Leslie Cho separates fact from fiction when it comes to the health of a woman's heart.
The American Heart Association and the American College of Cardiology recommend that all women above the age of 20 get their cholesterol checked. Every 5 years thereafter, if they have no risk factor, but if they have a risk factor, then every year thereafter.
Only men need to worry about heart attacks, right?
It's really important to control your risk factor, and the reason why we want all women to know about their heart disease risk is because it's something that's controllable. You can actually control and lower your risk.
Younger women don't have to worry about heart disease. It's just for old people.
With the obesity epidemic and increasing diabetes, younger women are having heart attack. And so it's actually not just a disease for elderly women, it's actually something we should all be mindful of. In fact, the way heart disease develops is over decades and decades of bad eating, not controlling your blood pressure, smoking. So even if we're young, especially when we're young, we should develop good, healthy heart habits so we can be disease-free.
Women don't need cholesterol drugs, do they?
Consistently, study after study has shown that women actually benefit greatly from being on cholesterol-lowering medicine. Women who've had heart attack, women who've had stroke, women who've had stents or bypass surgery especially benefit from cholesterol-lowering medicine. So it's really important to talk about these medicines with your doctor, to be on these medicines if you've had heart disease, because they can save lives.
I work out all the time, so I don't need to worry about heart disease.
Exercise is actually the best thing we can do for our heart, but unfortunately we can't control our parents and our genetic background. And so even if you exercise, it's still important to know your risk factors, to get your cholesterol checked, to know your blood pressure, to know your fasting glucose, to get seen actually regularly.
I don't need to worry about blood pressure and cholesterol medication because I take vitamins and supplements.
Fortunately, there is no supplement that's actually been shown to lower cardiovascular disease. Vitamin C and vitamin E has been studied in tens of thousands of patients, and it's never been shown to be effective. In fact, vitamin E actually may increase your risk for stroke and heart failure. There is actually no herbal supplement that's ever been shown to lower your heart disease.
I would know if I was having a heart attack.
Unfortunately, silent heart attacks is actually not uncommon in women, especially in young women. And so it's important, especially if you have risk factors, especially if you have family history, to be seen by your primary care physician or by a specialist to have a thorough evaluation.
For Fox 8, I'm Dr. Mark.
Dr. Mark is sponsored by the Cleveland Clinic.